So good morning and welcome to the final day of the 2022 Children's Week Virtual Conference. I'm so glad that you could join us for this morning's session. I am Dr. Ruth Adebuya. I am the Managing Director for the Stanford Center for Continuing Medical Education. Just a few housekeeping notes. First, this session is awarding both CME and ANCC credits. You'll receive an email from the Stanford CME office on Monday with instructions on how to avail of those credits if you are interested. Please use the Q&A button at the bottom of your Zoom screen to send your questions to our speakers, and they will take the time at the end of their presentation to respond to those questions. Oops, we go back. This morning's session is on return to play, and we are pleased to have Dr. Kristen Boyd and athletic trainer Kelly Rogers with us for this session. Dr. Christine Boyd is a clinical assistant professor of orthopedic surgery, board certified in pediatrics, and the medical director of the sports medicine program here at Stanford Children's Health. She practices pediatric sports medicine at Stanford Children's Health and sees patients between 2 and 25 years of age for a variety of conditions, including traumatic injuries, overuse injuries, concussions, burnouts, and much more. Kelly Rogers is an athletic trainer at the Stanford Children's Health Sports Medicine program, and she completed both her bachelor's and master's in kinesiology and athletic training at San Jose State University. Welcome to Dr. Boyd and Kelly Rogers, and I will turn it over to you for your presentation.
Unmute myself. Good morning, everyone. I am going to get started here. I thank you for joining us early on a Friday morning. I hope everybody's got good plans for the weekend, and that this morning's talk you guys find interesting and beneficial. So we're going to get going here. As you can imagine, return to play is a very broad topic, and so when Kelly and I just want to introduce Kelly too from perspective. So Kelly's athletic trainer, works with me in clinic. I couldn't do what I do in clinic without the athletic trainers and specifically Kelly. So I asked her to join me on today's talk because she sees everything I see and has a really good perspective on what we've seen over the last 2 years as well. So when we were talking about return to play, definitely wanted to focus a little bit on lessons from the pandemic. I do have to say, just as my disclaimer from the beginning, is that this is California style. I think you could give this talk from a variety of different perspectives across the country. And so you'll hear me several times say, in California, in California. The second disclaimer I'd like to start out with is I have no political opinion about what happened. I am going to go over kind of some of the controversies that occurred. I'm trying to keep a middle line. I think there's, a lot of opinions about things, but the main goal is to tell the story of what happened and how it affected the kids and what we saw when they went back and where we're at right now, a year after kind of letting the restrictions end, where the kids are in sports right now. Last disclaimer is I am not really good at these online Zoom talks and lectures, so I apologize in advance if I do much better if I see you guys in person, but here goes nothing. So the things that we're going to talk about today, are a look back through time, so how the pandemic affected the youth sports and activity, things we learned, specifically 3 key takeaways that came to mind when we thought about that time, and then where we're at today and the challenges that face youth sports moving forward. For those of you who have ever had a high school student take AP US History, you'll know that book in the top right corner. It was on my kitchen table all year long. And I think during the past 2 years, we've written an entire new chapter. So we just made AP US History a harder course. So January 2020, the main concerns for us in pediatric sports medicine were overuse injuries. I think if I was asked to speak on anything, it was emphasizing the multi-sport athlete, concussions. There's a lot of discussion about concussions across the sports medicine world, and physical literacy. All the talks and conferences that were going on at that time were more about how do we teach kids and individuals to be active. The big concern at that time was 2.5 million fewer kids had been playing sports over the past 5 years. A lot of this data, I'm just going to say right here, comes from the Aspen Play project. Again, I'll talk about that a little bit more later, but that's where this data comes from, and there's a reference at the end. So then we headed into February 2020, and there were some subtle changes in youth sports. For me, the most significant ones that I saw were, no handshakes, elbow bumps, no shared water. For the first time ever, kids were told if you had a runny nose or a cough or cold, don't come to practice. I mean, in the world of sports, you unless your arms falling off, in the competitive world, you show up. And we had no idea what was ahead. Honestly, I think we, at that point in time, we were just kind of rolling with the flow. Then, of course, March 2020, when everything happened, again, I'm going to just, history, we all know this, state of emergency in California, the pandemic. In California, it was a shelter-in-place order that happened very, very early on. Schools were closed indefinitely and outside activity was restricted. Honestly, youth sports were the last thing on anybody's mind, early on. But then we realized that we got a problem when the professional sports started suspending seasons, most noticeably the NBA, Major League Baseball, when the Boston Marathon got postponed. That's when we kind of knew something was really going on here in the sports world, per se. When the Tokyo Olympics were postponed, that was a big deal. And for me, when March Madness was canceled, I mean, I never in my life thought I'd see that. Then we knew that we had a significant issue in the sports world, per se. The other important thing that happened at this point were our state and regional parks were closed, encouraging people to stay home. So the first half of 2020, when schools were closed for the rest of the year, sports and PE went online. We felt, hey, this is better than nothing, but it was a lot of repetitive motion in a limited space. Actually, injuries do occur when you do too many squats or squat jumps in front of your computer at home. Some kids were very active, hike, bike, run, get outside. Other kids did absolutely nothing and stayed inside. So the experience was very different. The California stay-at-home order was extended early in 2020. And so again, different kids had different experiences. Different people interpreted the rules differently. Some people had different risk tolerances. Some people had high-risk individuals at home. So again, it was really, really variable. But for the most part, most activities were closed. Despite impressive efforts from everybody to stay fit, the overall hours of sitting per day dramatically increased. And this was from so the initial orthopedic effect, the policies designed to limit the spread of the virus definitely affected our the orthopedic sports injuries. So at Children's Hospital Philadelphia, when they look back at that in the year of 2020, initially there were a lot more injuries that happened at home. We saw kids falling off beds and couches. And breaking arms. There was fewer injuries on playgrounds, but there was no increased time to presentation. If kids broke their arms, they still came in to see us. We figured out how to take care of them. This probably is not super surprising information. Same thing on the surveillance data nationally. Sports-related injuries decreased. Organized sports especially decreased. Individual sports didn't decrease quite as much. Again, this all makes sense given what we know. In our group, we noticed a similar thing. It was really relatively quiet the first part of the year. Part two, world changed. So after 80 days of staying at home, the orders are easing a little bit. People are getting outside in their social bubble. There's some hope that California schools will be opened. More and more kids are biking, golfing, tennis, doing things outside, socially distanced. And then an important thing in California in particular, camps were allowed to start up. And so a lot of the organized sports teams organized camps that basically were getting them back on the field. Stable cohorts, but still no contact, no gameplay, no high-speed stuff. Again, even though this was somewhat encouraging for some group of people, many people still remained sheltered at home and chose not to venture out quite yet. Except there were the few. So there's something we like to call prohibition law. So it's good to remember that youth sports is a multi-million-dollar industry. In March 2020 alone, it's estimated that over 700,000 athletes were unable to participate in scheduled events. And there were major ones scheduled all over the country, costing up to $700 million to the organizers of the events. So there was a great incentive to get youth sports back going from a financial perspective. So many families of athletes in competitive sports started to travel out of state to regions with less restrictions that were allowing these events to occur, starting in about early summer. Some were even willing to move to allow their kids to play sports. There was a lot of pressure on club directors on both ends of the spectrum to either not play or play. I was part of several town halls with local sports organizations and heard, again, both groups of parents, some saying this was too much, some saying, why aren't we going? So the subsequent effect in the second half of 2020 for us, return to play, was outdoor activities increase, lots and lots of fractures, emergency room visits, closed reductions. We could feel that in clinic. In July, just to kind of give a sense of what's going on. Again, there was still delay that we were going to have any high school or youth or school-based sports for the fall, and you might not go back to school. That even pushed parents even further to seek outside opportunities for their kids to play. This is when we started seeing a lot more of the overuse injuries again, kind of the second half of 2020. But most of the injuries we saw in clinic were kids who were traveling out of state and then would come back, and then we would see them in the office for whatever injuries happened at events in Arizona. Nevada was a popular one. Utah was a popular one. So finally, in August of 2020, so this is quite a long time after the March shutdown, we got some guidance of what do we do with youth sports in California. There was a lot of question of what are we supposed to do with these kids, and so families were just taking matters into their own hands and traveling out of state, which maybe wasn't the best solution. So we got some guidance on youth sports. Again, physical distancing, stable cohort, outside, no shared equipment. But in the state of California, no contact sports were allowed and no competitions were allowed. Again, California was unique in this. There were other states that were similar, but again, California, the West Coast experience was a little different. But there were no restrictions on out-of-state travel in this August guidance. It just was not mentioned, no comment. So it didn't stop teams from traveling. Most schools in California at this time it was clear that they were going to stay online. The reason I keep going back to the schools being online is to preview or set the framework for Kelly's section coming up in a second. So by November of 2020, everyone was getting super, super restless in multiple states, including California. There were lots of don't want to say protests, gatherings, requesting, asking for kids to get allowed to go back to play again. The CDC recommended against travel for youth sports, but they encouraged competition versus local teams. So that's some of what started this, is that kids were like, let us play. The prohibition ball continues. Now the NC2A, for the most competitive athletes, extended their dead period till April 15th, which means there was no in-person recruiting. They could still watch live video streams and they could watch film. So they were trying to take the pressure off of the athletes who were in the recruiting age range to get back to competition prematurely. But some soccer clubs, one in Placer County, 90% of the families voted to begin traveling, despite all of the rules and recommendations. They felt they needed live games for college recruiting videos. ECNL in Phoenix occurred. It was in the fall. For those of you who don't know, ECNL is the top level of girls soccer, and they live stream games. And you can see here the parents sitting in their little social bubbles at the event. Many teams in California attended this event. The major California soccer tournament, Surf Cup down south, that's usually in San Diego every year, got moved to Phoenix so that it could be played. And so that occurred as well. So a lot of the kids who are playing competitive sports were already back in action. So this was, I'm going to step back a second. So then finally in December, the state of California came up with some better guidelines. So first, it's the first true guidelines in 9 months. They had sports risk profiles, team cohorts, so you could have one team and one sport at a time. So if you wanted to play on your high school team and your club team at the same time, you were not allowed. If you wanted to play baseball and soccer, you were not allowed either. So you had to pick a sport. Masks, tenting, and contact tracing were all required. Finally, in December 2020, California athletes were told they were not allowed to go out of state for competitions. The CIF announces abbreviated fall and winter seasons, which was super exciting for a lot of people. There was going to be spring football. There was going to be spring soccer. However, it was condensed into a very, very short time frame and would start super quick at the beginning of 2021. So for us, that was a little bit of a headache because we knew exactly what was coming. So when 2021 is a new year, the stay-at-home order is lifted. Competition is okay as long as you're in the same adjacent county. I put this picture here as a funny story. There was actually debate as to whether or not Alameda County, which is on one side of this bridge, and San Francisco, which is on the other side of this bridge, were adjacent counties. There's a bay in between. And so the soccer clubs were trying to figure out if they were allowed for the Pleasanton teams to play the San Francisco teams, because technically their counties are only separated by the bay and the bridge. No events with more than 2 teams, so no tournaments, couldn't go out of state. So this was finally, again, no out of state competitions. Finally, the major organizations, due to insurance and liability, stopped accepting California teams to come to their events. There was variable requirements for weekly testing. I'm not going to get into that. By April, they were able to go to other states, other unrestricted travel within the state. So the Northern California teams could play the Southern California teams, and things got back to normal. By June of 2021, the restrictions had pretty much expired. So what did that mean for 2021? It was busy. Our volume just skyrocketed, tons of acute knee injuries, lots of ACL tears, back, shoulder, shin, knee pain as kids were getting back into activity. These ACL tears were some of the hardest calls I had to make, because I had these kids who were juniors in high school. They missed their fall football season. They decided to play in this abbreviated spring season. They hadn't had any real game play for a long time. They go out there, they tear their ACLs. So now they miss their junior season and they're going to miss their senior season. So basically these high school kids are then done playing football. So those are some really, really hard visits and hard conversations. A lot of reasons why this happened. So there's deconditioning is definitely a main one. The CDC data suggests more than 400,000 kids and teens doubled their, it got cut off, their BMI during the pandemic, which is pretty significant. These kids are training in a very restrictive environment, doing limited, repetitive motions. There's a very shortened preseason, and then there's a condensed competitive season. So the condensed competitive season caused lots more games closer together and a lot more injury rates. It wasn't just young athletes. For those of you who are football fans at NFL, the rate significantly increased during the first 4 weeks of the 2021 season for a lot of these exact same reasons. All right, return to play 2021. The closures of the schools and organized sports definitely created a unique situation. The pandemic experience was far from universal, so it's really hard to make any gross generalizations. All kids were affected in some way, and return to play has definitely not been universal. Some kids were back playing at a highly competitive level within a few months, and so those kids did not experience any change in injury patterns or challenges returning to play. But most kids were restricted longer, 12 months or more. That seems to be about the average. Some still not made it back. So the lessons we learned in the pandemic: number 1, sitting is bad. Number 2, sun is good. And number 3, puberty persists despite the pandemic. So I'm gonna now take a second and switch my screen over to Kelly, or she's gonna take over, and she's gonna talk to you about sitting and why sitting is bad.
All right, hello. Can you hear me okay? Can you give me a thumbs up? Dr. Boyd, can you hear me? I can only see you. Okay, so before I start my section, I do want to invite everyone to just sit up a little bit taller, roll their shoulders back and down, and let's just take a deep breath. Okay, so that instantly made me feel better. And as we know, there's a scientific reason for this, which is what we're going to go into in just a minute. But first, I would like to take a poll to see where the audience is at with regards to daily posture. So please take a look at these different positions and pick which position you primarily find yourself in during the day when you're sitting. I find myself personally in posture C frequently because I naturally sit with this like arched back lumbar lordosis. And so I constantly have to find a way to like sit up straight and without arching my back and activating my core. So just please take a moment to rate your posture while sitting. Okay, so I kind of suspected that is posture B. So this rounded posture, a lot of us kind of naturally go into throughout the day, and we find ourselves having to kind of, sit up straight and roll our shoulders back. So I'm going to touch, of course, posture A is a good posture. I'm going to touch a little bit on each posture and the musculoskeletal imbalances that accompany them. How do I, oh, there we go. So now even when we have like relatively good posture throughout the day, we know that sitting for long periods is not the best for us biomechanically. COVID-19 caused the biggest shutdown of athletic competition since World War II, which directly affected our time at home. And high sedentary rates when sitting time exceeds more than 6 to 8 hours has detrimental effects on the development of cardiovascular disease, increased morbidity and mortality risk. And during lockdown, the younger population were sitting on average about 6 to 9 hours a day. So this, particularly for the young population, was a huge shift in their daily lives. It was so high in the youth because if we think about it, that was their social life. That was how they did their social life activities. At this age, all they want to do is be with their friends, and they couldn't meet up with them. So how did they do this? It resulted in gaming with friends or Zooming with friends, and that all required sitting. And this was in addition to all the online schooling that they were doing. I love this image to the right because it highlights that most of the time we're kind of going towards activities every day that require us to sit, and we're actually getting smaller bouts of these activities. We're like, you know what, I should get up and stand and walk. And those are like the shorter periods of time throughout our day versus, well, now you're sitting to eat breakfast and you're sitting on the way to school, you're sitting while you're doing school and so on. So let's talk about a little bit about what's happening in our bodies while we're sitting. So a cross-sectional study on 223 college students revealed that a majority of the students were sitting in this inefficient posture, and they adapted this sit-down culture of this awkward, non-ergonomic position during home confinement, and they experienced a lot of musculoskeletal and other health problems. I think we're all really guilty of this. This is a picture of me during the pandemic, and I'm literally working on the couch. Thankfully, I wasn't in this position a lot, but my husband caught me at the wrong time. And so I think that we all kind of adopted this new, comfortable position. And posture influences every physiological function of our body. It has either a positive or negative influence on our strength, function, performance, and overall energy levels. And so if you think about it, when our bones and joints are in correct alignment, it allows us to use those muscles how they're intended. So we have less fatigue and more energy. And in other words, our muscles don't have to work as hard in that correct posture, it makes sense, right? That's how we're built. On the other hand, posture results in change of muscle tone distribution. It changes body alignment and overall weakness in those really important stabilization muscles, which we'll go into in just a minute. I know sometimes we ask ourselves, like, where did 2020 go? Like, how did that go by so fast? But this was not a short period of time. This was over a year. A lot of us were getting used to this new work or school, wherever is comfortable lifestyle. And that brings us to our athletes, our younger athletes that are deconditioned and jumping right back into sport after this shutdown. So yes, we did see these athletes do individual training at home, but the most difficult aspect of training to replicate when you're training individually is the intricacies of sport, especially in contact sports, right? So the physical and mental demands while you're changing direction at a high speed, running with the ball in hand, making quick decisions when you're approaching another athlete, those athletes weren't able to practice those skills. So our society gradually reopens to pre-pandemic levels. And like Dr. Boyd was talking about before, the consequences of sport hibernation became increasingly evident as sports started up again. The combination of deconditioned changes in body composition and then loss of variety in training elevated those return to play injuries. So what kind of changes did we see in our athletes that were coming back when returning to sport after the stay-at-home orders were lifted? So I'm going to start kind of from top and go to bottom. As you know, as you can see on, we all had a lot of that posture B position where it's with the rounded shoulders. During the pandemic, this was very common for adolescents to sit in this rounded posture, which causes multiple musculoskeletal issues and imbalances in the upper extremity. So when we have this rounded posture, we get pectoral muscle tightness right in the front, and then we get this scapular stabilization weakness and upper back weakness. And then what this does is it limits that subacromial space in the anterior aspect of the shoulder. And that's where a lot of that's where your rotator cuff tendons live, your bursa. And so you're closing that space, causing kind of impingement in that area. So let's take, like, for example, a baseball pitcher that comes back from stay-at-home orders and trying to get to that high pitch count relatively quickly, right? They're so excited to get back. Well, if you can see why, all of these muscular imbalances and then throwing, you can see why we saw these patients coming in with rotator cuff impingement, scapular dyskinesis, and other or bursitis and other biomechanical deficiencies. So in our evaluations, a lot of the times I would walk into the room and I kind of read, okay, 13-year-old male baseball player. I walked in and they were sitting all hunched over, and I automatically kind of knew where to go with my examination. So sitting for long periods, whether you're in a good or bad posture, you can see on example B on the right, your iliopsoas, which is one of your primary hip flexors, is shortened just naturally, even if you're in a good posture, and then your hamstrings are shortened too. And what also is happening that you can't see on that image is that your gluteal muscles, your stabilizing muscles, become weakened. Now, this is an unfortunate chain reaction that we see all the time. So shortened hip flexors and weak glute muscles are two of the biggest precursors for knee valgus. And that puts a lot of stress when you're squatting or you're running, puts a lot of stress on that inside of that patellofemoral joint. So your medial patellofemoral joint, your hospice fat pad, which lives under your patellar tendon, and then your patellar tendon itself gets a lot of extra stress. As you can see in the picture too, it puts a lot of stress on the lateral aspect of that girl's knee, right? So it stretches out that IT band, your biceps femoral hamstring tendon, which is in the posterolateral aspect of the knee. It's all getting extra stretch and stress. So when these athletes were returning to sport without a stretching or strengthening regimen to correct these deficits, they were coming to our clinic with patellofemoral pain, Osgood flutters, tendinitis, even, like Dr. Boyd mentioned, a lot of ACL tears, which were devastating after they were out already for so long. And this was all from that deconditioning and tightness. Okay, so we cannot forget about the kids that came in to our clinic with low back pain and tailbone pain, after sports were back in action. So I love this gift because it really gives us a true representation of what's happening internally and skeletally when we're having bad posture. So, I mean, even when you're having good posture, your hip flexors are shortened, right? But when you're having bad posture, your hip flexors are even more shortened, and your core is completely deactivated. And then there's an abnormal amount of pressure on that coccyx bone. So this gift honestly makes me really want to stand up. So please feel free, if you need to, you can stand up and listen as well. It always makes me want to when I do that. So when these athletes came into clinic, we didn't really even have to ask them how much they were sitting, because at that time, when they were returning to sport, a lot of the social distancing was still very prevalent. And so we reframed our question to, how much activity were you involved in? And that kind of gave us a better idea of how much they were standing throughout the day. We saw a variety of musculoskeletal diagnosis, but we did see a higher prevalence of spondylolysis, which is a stress fracture within the pars interarticularis. We see it primarily in the lumbar spine. So especially primarily with these athletes that are jumping back into those like repetitive extension type motions with a weak core, tight hip flexors, weak gluteal muscles, all their stabilization muscles aren't activated correctly. And so, so we saw that frequently. And then of course we had those endless patients coming in with just like, oh, my tailbone hurts, all that pressure on the coccyx, and primarily with sitting activities. So I think it's safe to say that we're kind of past that return to play point, and that athletes are back to their normal activities, volumes, intensities, and injuries are, I would say, slightly normalizing in our clinic. So what works? I mean, this is not new information to us. We know what keeps our athletes safe and injury free. I think one takeaway I do want to leave you with is the importance of posture while we are seeing these adolescents sitting more, right? So online schooling, mobile devices, gaming, we're seeing more of this. And so when providing this education on posture, it's essential that it meets the reality of the student's environment and address situations related to their daily lives. So really asking questions about their day-to-day and find what helps them, which will likely include involving their teachers or their parents to give continuous cues, and also understanding and that they also understand the importance of good posture. This requires long-term and continuous reminding to fix posture and to establish adequate strength and muscle memory in those stabilizing muscles. I mean, if you think about it, it's not a quick fix. Just think about how long it takes us to develop these muscle tendencies and our kind of go-tos for posture. I mean, we know that continuing to stay active is extremely important. Exercise, I mean, in itself helps our posture to move the articulations of our body and strengthening those postural muscles that support our spine. Our athletes were very eager to get to sport, and there was rarely a ramp-up period or gradual return to play that is absolutely necessary to prevent injuries. It's that fine line, you know, staying active, but also resting, but not too much sitting. It's kind of that fine line to avoid injury, but also stay healthy. So just to conclude this section, sitting, especially in poor posture for extended periods of time, is not good for you, but staying active can counteract those negative musculoskeletal effects. So now we talked a little bit about what's bad. Let's talk a little bit about what's good.
All right, Kelly, you want me to switch over now?
Yes.
All right. Here we go. All right, so I'm going to switch over to the next slide, which is sun is good. Okay, well, that's a little statement. Kelly, can you hear me and see my screen? Just to double check, give me a thumbs up. Yeah, good. All right, so sun is good is definitely a loaded statement. Obviously, there's skin cancer issues with sun. However, a lot of studies have shown some beneficial aspects of sun exposure, including vitamin D. More recently, there's been a kind of a push-pull between the doctors advocating for some sun for bone health and the dermatologists advocating for less sun for skin cancer risk. And actually in Australia, it's quite interesting. They're changing their messaging about sun exposure to try to both issues. So in 2020, so in clinic, so in 2021, as we kind of took all the restrictions off and these kids went back to sport, I'm just going to show you a case of a kid who came in. So this is a 13-year-old gymnast. She had 4 weeks of thigh pain. She hadn't really changed her training volume. She'd been back to full training for more than 6 months, but she had still spent, you know, most of 2020 and the early parts of 2021 online school, sheltered at home, etc. Her exam showed pain when she hopped up and down, so impact activity on that leg. Pain with the Fulcrum Test, which is a test where we kind of put stress on the bone itself. Did an X-ray and saw this. I know this doesn't. It's kind of hard to see, but we can see some periosteal reaction here along her femur, which is consistent with a healing stress, basically a stress reaction or stress fracture that's mounting a healing response. I checked her vitamin D level because it didn't seem like, you know, I don't see very many 13-year-old gymnasts with femoral shaft stress reactions. Her vitamin D level was 18. That caught my attention. So what do we know about vitamin D? So vitamin D, it's a major role in bone health. I could give an entire talk for an hour and a half on vitamin D. So that would be a topic for a different day. But for now, we're going to just know that vitamin D is important for bones. It helps in mineralization and calcium regulation. There are lots of different opinions about what's considered sufficient, insufficient, deficient. The one consensus is under 20 is considered deficient. Athletes, we try to target more than 40, and anywhere in between is considered insufficient. Again, this is more for the athletic population than the pediatric population, but under 20 is definitely deficient across the board. So the sources of vitamin D, for the most part, you get it from, there's either exposure to direct sunlight, daily sources, or supplements. Daily sources are challenging to get. So a lot of times supplemented food is probably the most common place to get it. Sun is also a crucial element of how we convert substances in the body to active vitamin D. So the UVB rays are important in creating vitamin D in the body. Individuals with darker skin do not convert vitamin D as easily. Cloudy cover also decreases vitamin D. Wearing sunscreen decreases your body's ability to make vitamin D. And obviously covering your body with clothing that blocks UV rays is going to affect it. Fortified food is very common and is a common way to get vitamin D. And then supplements also are a commonplace and one of the easier ways to increase your vitamin D level. So what is deficiency? So currently deficiency in the pediatric population is reported in many, many countries. So again, this is going to be the less than 20 level. Great Britain, Austria, Germany, Finland, New Zealand, India, they all have studies reporting vitamin D deficiency in their pediatric populations. Even sunny Australia reports up to half their kids as being deficient because they do cover and protect from the UV light. It is affecting the body's ability to make vitamin D. So 2021 clinic, 15-year-old, no sports. Just a normal, active, normal kid sitting around doing her normal thing, hanging out with her friends. She had 3 months of some mild foot pain. Didn't think much of it, walking around the house barefoot a lot. She started to run in PE because school started again. She had a significant increase in pain. So she started running in PE, and that's what caused the mild pain. Then for Labor Day weekend, beginning of the fall, she went to the boardwalk and walked around all day with her family and had significant increase in pain walking at the boardwalk. Her exam showed diffuse ankle swelling, warmth, and tenderness, which seemed odd. So I'm thinking the x-rays look normal. You know, is this an infection? Is this an inflammatory condition? I wasn't really thinking stress injury, but you know, it's on the differential. Sure enough, this was her MRI, and she had a stress fracture of the distal tibia from running in middle school PE and then walking around Santa Cruz Beach Boardwalk at Labor Day weekend. So pretty significant bony stress injuries in her foot and ankle. Her vitamin D level is 16. So we treated her with boot MRI. I did order labs because I was concerned enough about how diffuse the swelling was. I was never expecting this based on that history. So the pandemic and vitamin D. So before the pandemic, it's estimated, these numbers are all over the map, but I'm going to pick 15% of kids and teens in the US were vitamin D deficient. During the pandemic, less sun, less vitamin D. So we were sheltered at home for organized sports. We were online learning. There's no recess, lunch breaks, walking to and from school. Even those brief 5 minutes of exposure to sunlight is important in converting and creating vitamin D in your body. We closed playgrounds and parks so kids were not playing outside. Bad air. For those of us in California, we experienced this. In fact, more than 70% of California experienced more than 100 unhealthy air quality days due to the fires. So the carbon particles from the wildfires scatter the UV rays, which also decreases the vitamin D production. So we had a combination of things going on here in California. So the emerging data is that there was an increase in vitamin D deficiency, a significant increase over the course of the pandemic. A couple of studies, and again, sometimes it's hard to find studies because we're so close to the experience. And I think over the next 5 years, we're going to see more and more of this information come out. But what's available right now is Japanese football players, so specifically professional soccer players in Japan. They had 13% of their, again, these are adults, were vitamin D deficient in 2018, and during the pandemic, everybody was, even in the summer months. Turkish children showed there are 3,000 of them, significantly lower levels. Even in China, there's a recent study that's coming out, it was published online last month, showing the same thing, a lot of vitamin D deficiency in their children. So again, going back to clinic and how we experienced that, 12-year-old, we're not talking a high school athlete, 12-year-old, 1 week of left calf and knee pain, had been running with her sister around the block for fitness, and they were running like a mile or two. That's it. She previously was inactive, so not an athletic kid, just a normal kid who was, going about her business. She was wearing old shoes. Her exam, so her exam showed pain back in this area. Initially, she was ordered an x-ray of her knee, and it was reported as normal. So she came in to see me actually for knee pain. You can see if you look outside of her knee down here, it's not normal. So we ordered tip bib films, and sure enough, there she has a healing stress reaction along the proximal part of her tibia. Again, Such an odd story. A 12-year-old with hardly any activity. I mean, I think she just went a couple times to run with her sister. Just didn't seem right. So we did order an MRI of her, which showed a rip-roaring stress fracture across the proximal tibia. Again, her vitamin D level is 31. That's not that low. And that's right on the border of what's considered adequate. But still, something was going on there. So what do we know about vitamin D and stress fractures? In the office, stress fractures, repeated mechanical stress of the bone over time. I use the example of a paperclip all the time in the office to kids, where if you bend it once or twice, it just gets a little bit warm. That's a stress reaction. If you bend it a bunch of times, it cracks. That's a stress fracture. It's injury to the bony trabecula, which is this picture at the top. It's basically suboptimal bone remodeling. So the imbalance of osteoblast, osteoclast activity leads to incomplete repair, weakened bone, and ultimately a stress fracture. So the vitamin D deficiency is a known risk factor for developing stress fractures. I'm just going to skip those. So in NC2A athletes, 12% higher rate of stress fracture if their vitamin D level is under 40. Their vitamin D supplements decrease the incidence of stress fracture in Navy recruits, and soccer players with fifth metatarsal stress fractures had low vitamin D levels in Japan. So all over the country, all over the world, we're seeing this. In 2021, our experience upon return to play is we had a ton of lower extremity stress fractures. They were unusual locations. They were very atypical histories. I mean, I just assumed everybody who came in, I had to rule them out for a stress fracture because it was so bizarre. That's changed. We've gotten better. Now we're in 2022. But it was definitely a year of stress fractures. And this was an experience across our group. When I talked to my partners, we all were feeling this and seeing this. So why did this happen? It was probably a combination of suboptimal bone health, so vitamin D deficiency or insufficiency, deconditioning. So when you're deconditioned, it increases the fatigue, weakness, and imbalance and the load distribution on the bone. And then I'm going to switch over to Kelly. Nope, I'm not. This is for me. This is to remind me that that's the end of my vitamin D section. All right. So again, I think it was multifactorial, vitamin D deficiency, deconditioning. Again, this is getting better. We're not seeing as much of it. But I do think, and I always remind my, especially my teenage athletes, I do think a daily vitamin D and calcium supplement is a good idea. I think the risk is minimal and the potential benefit is high. Even today, I opened up our Stanford little newsletter, and there's some research about vitamin D and dementia. Yesterday, I was reading an article about vitamin D and osteochondritis dissecans. So I think there's a lot to be learned, and we're going to learn lots more about vitamin D in the next 10 years. But I do think it's worth supplementing athletic young people. All right, so now I'm changing over to puberty, and this is just a slide to remind me of my mischievous son getting into mischief when he was little. Okay, who is now a 12-year-old boy entering into this area of his life, which is rapid growth. So school, sports, socializing, they all might have been paused during the pandemic, but puberty did not pause. The kids grew. I've had several friends who say we went into the pandemic and my kid was shorter than me. We came out and they're taller than me. So the puberty, during puberty, you have peak height velocity. So it's a period of rapid growth. Many of you know a lot about this, especially the pediatricians in the office. But it's the fastest period of growth in your whole life. The physiologic and structural changes to the bone, cartilage, ligaments during this period of rapid growth increase the risk of injury. There's decreased core strength and postural control in this group of growing athletes. Their change in body habitus changes their alter of gravity, proprioception. That's why they get gangly and uncoordinated and look like they're running funny at this point in their lives. Longitudinal bone growth causes muscular tightness and loss of flexibility. So not only are they uncoordinated, now they're tight. It just increases the risk of injuries altogether. And we see this a lot in the office. This is normal. This was pre-pandemic. Then we go into the pandemic and these kids experience these same changes, but it was magnified because they were deconditioned and then they had an abrupt return to play with this new body that they hadn't gotten used to. So again, this caused a lot of increased injuries, especially in kids in this age group. These are more acute injuries. All right, so I'm going to shift gears real quick. You've been listening to us for 45 minutes. I promise you we won't yammer at you too much longer. Make sure you fill up that Q&A with questions because sometimes that gives, those are the best for us as far as sharing information. Okay, so where are we at now? So the evolution of sports. Did the pandemic break, the break of sports during the pandemic change our long-term youth sports culture? So we're going to talk about that for a second. Prior to the pandemic, kids were already losing, we were already losing kids to organized sports. Did they come back? So there's an engagement question about youth sports today. And the equity. Sports came back, but did they come back for everybody? So evolution of sports. So pre-pandemic youth sports, highly organized, competitive, expensive. During the pandemic, kids returned to playing on their own. There was a surge in participation in new outdoor sports: golf, tennis, fitness equipment, bicycles, and then our favorite, trampolines. So again, trampolines are high injury risk, so we saw a lot of trampoline injuries. So we had high hopes during the pandemic that maybe we would make a shift away from this crazy, organized, expensive sports culture. Families might reevaluate where sports fit in the family hierarchy when they notice that the kids will play outside and they spend time enjoying physical activity together as a family. Step back from the hurried schedules of competitive youth sports, focus more on community-based leagues, lower cost, less travel. Some parents may realize there's just too much emphasis on sports in their lives, find other activities to complement with more healthy relationships. 2 years later, does not seem to be the case. A majority of kids in our office, in our community, have gone back to where they were before. And the question is why? And I think it's been pretty clear that families really missed the organized aspect of youth sports. They missed the structured social aspect. And I think that maybe there's a good lesson to us that there's some mental health involved in that. And so I'm going to pass over. So we want all kids to play, given the physical, social, and emotional benefits of sports. But how do we maximize these benefits without getting back into that crazy cycle of stressful competitive sports for kids? Kelly, can you answer those questions for us?
I think I can. Okay. All right. So mental health deserves an entire presentation in itself, but I'm going to touch briefly on mental health as it pertains to the young athletes that we've seen returning to sport after the stay-at-home orders were lifted. The pandemic was an unpredicted and uncontrolled change event that affected everyone very differently, depending on their situation. And let's touch on a couple of these areas, but before I do that, I want to acknowledge that there are other factors aside from lack of sport participation that have played roles that may have played roles in mental health, such as lack of social interaction, increased economic uncertainty, and social media access. So high school seniors, I mean, we all felt for those seniors that lost those experiences, right? So these athletes were faced with a sudden end of their scholastic school sports season. I mean, think about how devastating that is. They've worked 4 to 8, maybe plus years building up to this moment, and all of a sudden it was just taken from them. Also, they may have missed opportunities on recruitment and so on. And then in addition to that, they missed these extracurricular activities that they were looking forward to in their senior year, big events like graduation. It was really sad to see. And so we can understand why these specific athletes reported higher levels of anxiety and depression. For teen sport participants, the research is somewhat contradictory, but overall, teen sport athletes reported worse symptoms of depression and anxiety and lower levels of physical activity than athletes that were in individualized sports. And this could be because individualized sport athletes were able to continue participating in their sport with those social distancing requirements. And it also ties into why team athletes were more affected by the loss of athletic identity than individualized sport athletes. So, I mean, moving forward as sports medicine professionals, we may be able to use this information to advocate for team sport athletes to temporarily transition into a more individualized sport if their team sports are prohibited again, but hopefully it won't be to the extent that it was before, but anything happens. So it's just, how are we going to prepare for this if our team sports are prohibited in the future? Athletes in lower income areas, athletes that came from a low socioeconomic status were already at a disadvantage prior to the shutdown. And then when compared to the wealthier areas, with reporting less access to club sports and not feeling safe exercising outside of their neighborhood and public sport facilities. So those barriers became much more complex during the pandemic. So now that we touched a little bit on or we kind of have an idea of how the shutdown affected adolescent athletes differently, let's talk about the challenges and benefits of returning to sport. So athletes experience many challenges when returning to sport after time off, but going back to what I said previously, that this is the biggest shutdown of competitive sports since World War II. So there were many new hurdles to clear when coming back from a pandemic. So in addition to most likely feeling underprepared, right? You're like, oh, sports are back. And so we're maybe not feeling as prepared as we were before the pandemic. And then concerns about sustaining injuries after being out already for so long. There were these additional fears of unknown health consequences after being infected with COVID-19 or acquiring or transmitting COVID-19 to your teammates. So there was all these new stressors that these athletes had. And so it's important for us to understand the complex nature of sport participation and what our athletes went through when returning to play was very real. At the end of the day, research continues to show that athletes report overall lower levels of stress and anxiety when compared to non-athletes. So this research has been there for a long time, and it's continuing even pre and post pandemic. And I think it's reassuring that sports continue to be that positive influence physically and mentally to us, which is a good segue into our next topic.
All right, engagement. You're good, I'm good. All right, everything's good. Okay, so kids continue to lose interest in organized sport. It's definitely still a challenge. Post-pandemic, the loss of interest is actually shaped by where the kids lived. And again, this is new data because we're just a year out of that. Children in California and New York were twice as likely to have lost interest in sports than their peers in Texas. Urban kids were twice as likely than suburban kids to no longer be interested. Many kids who did return to sport return at a lower level, and that varies by ethnicity, and I'll show a slide on that. But Hispanic and Black youth were definitely more likely to return to sport at a lower level than where they were before. So again, these are some busy slides, and these are all put together by the Aspen Institute. They have some great information. It's all available online if you're interested in looking at it more. But it's talking about kids who played sports before COVID and have since lost interest. And so I gotta make sure. So again, by all kids 27, you can see ethnicity-wise, the African-American community definitely lost more interest. It's interesting because the income did not seem to make a difference. Sport was a big deal. Baseball took a big hit, and so did basketball. And then California and New York, you'd see statewide took a big hit. Equity. So the pandemic fallout for youth sports was not distributed equally, and I think this is obviously super important. Asian American youth were reported losing the most interest in sports during the pandemic, more than any other race or ethnicity. In a September 2021 survey, so that was 6 months ago, 9 months ago, half the parents agreed that the risk of illness was still a potential barrier for returning to sports. So even though we talk about all these injuries and all these kids getting back to sports and things are back to normal, for a lot of kids it's still not back to normal. Again, and this debt tends to be not distributed equally. With Hispanic and Black parents tend to be more nervous about sending their kids back to sports. Again, this is 2012 is the red, 2020 is the blue, 2019 is in between there. So you can see that the progressive decline in sports over the last 8 years, and from 19 to 20, which is you're assuming is pandemic related, but it's hard to tell just because there's already a downward trend. In lower income houses, they actually increase their sports participation. And that's partly because of what defined as sports participation. And the parents were home more and available to go out to the field and park and throw the ball around. Equity in the youth sports. So the current youth sports system, it's early forming expensive travel teams. There's lack of quality alternatives. So as you can see from our prohibition ball, all of those kids involved in that group were back to sports right away. But that wasn't cheap. I mean, it was very expensive to travel, and a lot of families had to rent or buy an RV. They had to stay in private houses. It was very, very expensive. It wasn't like you could just send your kid with the team to go play. There aren't a lot of good alternatives for sports. We're losing more and more of the sports teams that aren't competitive. It just structurally limits the opportunities for kids from low-income homes. The pandemic made this even more prominent. Again, prohibition ball teams were back within 2 months. Community based programs were much, much slower to return. So the good news is we've made some progress to enable change. We might not see the change yet, but there's been a lot of great changes that are heading in the right direction. So some major organizations in the last year, Nike, ESPN, Under Armour, Dick's Sporting Goods, they've created grant programs and contributions to programs supporting low-income communities. In fact, Dick's Sporting Goods sponsors athletes and gives them a gift card that they can use towards any sports club or organization. New York was the first state to allocate 1% of the proceeds from sports betting goes to youth sports programs. And there's new federal support matching grants to communities to help build and restore their outdoor recreational facilities to help build those the community-based sports programs. So the goal here is to equip nonprofit and community-based sports organizations with tools to improve their equity and inclusion practices. So I think if anything is going to be gained out of the pandemic, it's not. Unfortunately, I think the competitive organized youth sports group is going to continue to march on, and we're not making a very good headway in addressing that. But I do think in parallel, we are putting a lot more effort into building our community-based sports programs, so there is a good optional and an alternative. A lot of references, feel free to browse through them, but more importantly, thank you so much for spending your Friday morning with us. We're here to answer questions. Please fire away. Can't guarantee I can answer them all, but I'm happy to. This picture reminds me of the pandemic. This was one of the photos we took during the pandemic, and it was nice to slow down in life enough to take advantage of experiences like this. But I like to remind myself of what that was like, that there were some positives that came out of that crazy, horrible 2 years of our lives. All right, so I'm going to, I don't know, do we have a moderator on now?
Yes, thank you. Thank you both for such a great. Would you like
me to stop sharing my screen?
Yes, if you don't mind, that would be great.
Awesome.
Excellent. We do have some questions to start with in the Q&A, and I will just encourage the attendees to populate some more. If you have some questions, we do have quite a few minutes for question and answer. So let's begin with the first question. I think came earlier in your conversation or your presentation from an anonymous attendee that says, many coaches are going straight to dynamic stretching. Should kids be starting with static stretch warm-ups first to avoid the pull injuries that we saw last season?
I can start with that, Kelly. If you have anything more you can add to, but I think static. They both play a role. I think when the kids show up at the field, starting with some easy dynamic stretching is a very healthy way to start. I do think that the static stretching should target certain muscles. So what I usually like to do is a dynamic warm up, couple targeted muscles or static stretching, and then practice. And then a lot of the beneficial stretching actually comes after practice too, because then you'll feel the benefit the following day. So I do think that practice is better starting with a dynamic piece, but there has to be a static piece afterwards. And a lot of times I don't see that. They go from static right into sprinting. I mean, dynamic right into sprinting. So I think adding that few minutes to target static stretching would be helpful.
Kelly,
I'm gonna add something too. Yeah, I always try to encourage athletes to have, like, when you're warming up, if you could try to get with dynamic stretching or doing light jogging, going on the elliptical, something to get your muscles a little bit warm. So for your body to just be a tiny bit warm, I always do the analogy of like putting a rubber band in the freezer and then trying to stretch it. So we don't want those muscles to be cold. And I think that is what's happening when we have these athletes that are pulling, their muscles, is we want to make sure, yes, dynamic stretching is important, but also that before you do those plyometric and explosive movements that you're not cold, because I think that's what really contributes to it as well.
Excellent. Thank you both for that response. The next question, I think it's directed to Dr. Boyd. I feel like I saw so many of these non-active kids with pain and a normal exam and x-ray. So I likely missed stress fractures. That's a question.
Probably not. I mean, you might have missed some bony stress that was going to get better with time. There's no harm in that. You know, honestly, the treatment for these is rest. It's rest and shoring up their nutrition and their vitamin D activity. So there's no magic to treating a bony stress injury. And so a lot of times I'll have kids come in who, like at the end of a cross country or track season, who I'm highly suspicious their x-rays are normal. And we just treat them with rest, and we have them shut it down for 4 to 6 weeks. And if they have pain afterwards, we'll image them. So, yeah, I mean, we probably all miss some bony stress injuries. If it was a true and true fracture, you wouldn't have missed it. Trust me. I know that. But I'm sure you treated it correctly, because otherwise they would have come back. So there's no harm done.
Excellent. And then the next question was a general one, and I think that this is a great question for both of your perspectives. The question is, could you review return to play after mild to moderately severe acute COVID infection? Might be interesting to hear it from both of your perspectives. So Kelly, do you want to start, and then go to Dr. Boyd?
Yeah, I think like coming back from any flu or any type of like sickness, we have to remember that we lose a lot of that cardiovascular endurance, right? So I think having that gradual return to play is really important, and not to push yourself really hard in the very beginning. And so just to start light, maybe do half the practice and see how you're feeling, take the rest of the practice off, and then you can kind of gradually add minutes before going into that full competition.
Great. Dr. Boyd, thoughts?
Yeah, so I can tell you honestly, we've been deferring a lot of this back to the pediatricians because the information is so rapidly changing. But I think a lot of it's unknown. I think a lot of it's unknown and it's variable kid to kid. But I think initially making sure that I think it's got to be done in a gradual fashion, making sure that they don't have any symptoms. We usually like them to be seen by the pediatrician and cleared for return to play. And then we, from a musculoskeletal standpoint, will ramp them back up.
Fantastic, thank you. I think it's also great to just acknowledge how fluid things have been and how things are changing and how it differs from kid to kid. So I appreciate that response. Yep. The next question says, I've specifically seen a lot of kids struggling with return to PE, let alone sports, especially around testing time. Given your presentation on return to play during the pandemic, how do you think we can communicate with schools that children may need a more gradual return? Really excellent question. So I don't know who wants to go first.
I can tell you that we write a lot of keynotes for some of these kids. And I think sometimes the kids come in and they're almost afraid to ask for the PE note because they don't want to be felt as they're trying to avoid it or being lazy or anything of that nature. But I think a lot of them are very, very much valid. The PE teachers and that group is a very, very hard nut to crack. I think the best way is probably individual within your community, school by school, just developing a relationship with the PE teachers. One of the things that can be really helpful when I write PE notes, I typically give a lot of things they can do. It's not just no PE for 3 weeks. It's they can do this and this. They can't run more than 400 yards. That just to give direct instructions. I feel like when I've tried to go to the school district or the schools directly, it has not been very productive. But I agree that the PE teachers are trying to aggressively get these kids back in shape. And for some, it's fine. And for a lot of them, they really, really struggle. So I think really spending the time to write the detailed notes to the PE teachers will help you build a relationship with them, even if you never meet them in person, at least so that they know that you're aware of the situation.
Great question. Kelly, any additional thoughts to that?
I think what's helped too is sometimes we're so quick to write these PE notes, but what I think helped Dr. Boyd and I is asking what are you struggling with specifically? Because we get a lot of information of after I run 3 laps, I get a lot of knee pain or something like that. So then we can tailor our notes to be really specific to their needs. And so sometimes I'll sit in the clinic room with the parent and the patient and just write this PE note to really tailor to them. And then, if it's still going on for 3 to more, I'll put like 3 weeks. And if it's still going on, we want to see them back in clinic anyway. So we'll redo the notes. So just trying to be, collaborate with the parent and the patient and see what they're actually struggling with. So we can tailor it to that. And I think the more specific you can be is really helpful for the PE teachers, because they have a lot of kids running around, and it's hard for them to be like, okay, you can't do this, you can't, so being as specific as possible is sometimes helpful.
Great, thank you. Thank you for that response. So the next question is around vitamin D, and I don't know if it's one that, as Dr. Boyd, you mentioned, there's a whole nother lecture that could probably take place around vitamin D. So feel free to kind of respond in like a succinct way to this. But this person wants you to comment on vitamin D, how early, it might be out of scope, but how early sunlight helps sleep. And is there a direct metric of lack of vitamin D and hours of sun exposure? You gonna take a stab at it, or just kind of say more information needed?
I guess the one comment that I would say is that it's not, kids don't need to be out sunbathing to get a lot of vitamin D. There was one recommendation from the dermatologist saying, 15 minutes, the first 15 minutes of sun exposure should be without sunscreen. And then after that, and that's enough for the day. And then, lather up, do your slip, slap thing after that. But that's a good way just to make sure your kid gets enough sun for the day. So they're like 15 minutes of sunlight and then cover up. So I don't think there's an exact, it varies by person too, based on their, the air quality, their skin color, their metabolism. So I don't think there's a direct metric on that.
Okay, excellent. And then another question on eye movement metrics. Do you use eye movement metrics for your assessment of TBI?
So that's a concussion question. So, in our office, we pretty much our initial screening for concussions is usually with the vestibular ocular motor screen, the VOMS and the BES, and then a symptom score. And then if things are not looking good at that point, we loop in the vestibular ocular therapist, and then they do some of that metrics there. So that's what usually happens.
Okay, excellent. This might be a great question for Kelly. Was there any management from physical medicine and rehabilitation for the evaluation and treatment to help the kids in their return to activities? In case it was, what was the input from physical medicine and rehabilitation?
I don't know, did we refer specifically to physical medicine rehabilitation, or are we just talking like this is different than physical therapy? I mean, this is PMR.
No, so yeah, Kraus is our PM&R resource. Yeah,
I would say we use her a lot actually with these running athletes, because she specializes in that. So she specializes in running athletes and stress fractures and female athlete triads. So with these athletes that continuous, like they got stress fractures in different areas, and we would check their vitamin D. We kind of did our initial check. We would refer to her quite frequently for a treatment plan and continuing care. And she helped doing like a full workup for them.
We used our motion analysis lab as well. So we have 3 non-op primary care sports docs within our pediatric group, and one of them is trained in PM&R, and so that's who we're referring to. And so, especially with runners or distance athletes, if there was chronic return to play issues, we would either use a motion lab or we would refer to her. Otherwise, our physical therapists in our office are awesome, and they did a great job.
Great, thank you. We have one last question in the chat, and before I do so, just reminding people to go ahead and get your next round of questions. And if we don't have any questions, we're happy to end early, but want to give everybody the opportunity to type in their questions. So last question I have here in the Q&A is, with high school aged athletes, did you in general encounter greater challenges with figuring out proper return to training or play with the teens or with their parents?
For me, it was the teens. I thought the teens were super, super motivated to get back, especially the kids who want to get back to sports and athletes. And I found more of the parents were they were excited that their kids were back, but they were also kind of going like, oh my goodness, of course you got hurt. You went back at 110%. I think our biggest challenge, honestly, with our high school athletes is that they're starting to go back and they needed guidance. And physical therapy was very, very, and it still is hard to come by. Our physical therapy clinics are absolutely swamped, and kids are having to wait weeks to get in. And so that's actually one of my biggest challenges, because I think they need guidance and education, and they need hands-on work. And so trying to get a PT appointment is like gold around our place.
Kelly, how about from your perspective?
I feel the same way. I mean, I think that we only have a certain amount of time with these patients in clinic, and we do our best to give kind of a step-by-step process of what that return to play program, what that looks like. But it really is like a day-to-day type of thing, right? Because they're doing a step, and then they need to really check in with someone and be like, okay, I did this and I had no pain. Can I go to the next step? So that's the attention that these athletes really need, especially the ones that are coming back from these repetitive type injuries that have been sustained over a long period of time. And so that's why the physical therapists are so great, because they can do a throwing program with the athletes and check in with them consistently. I mean, we do our best to, message athletes back and forth through my chart and things like that. But yeah, it is, physical therapists have been really great in that aspect, but it is hard to get those appointments.
Another question just popped up in the Q&A. In case you used it, what was your experience with telemedicine and the evaluation and treatment of your patients? Dr. Boyd?
Yeah, of course we used it. We had to. I found that it was very challenging. That we got creative when we had to. Obviously fracture care, it's irrelevant. Even within our group, there were some doctors who like telehealth more than others. Most of it have kind of shied away. For me, the most helpful thing was MRI reviews, so I could go over MRIs with families, and concussion follow-ups. So exams are normal, but I just need to talk with patients. That was the most useful. But we used it a ton. We did our best we could with it, but once we had access in the office, we brought everybody in.
Great. Kelly, any thoughts on this one for you?
I don't think so. I mean, I worked a lot with telehealth in the very beginning, with multiple providers, and it was interesting actually to see how creative providers got in, they would have the parents sometimes be like, can you press here? Can you do that? And sometimes I would even call before, because I would like set up the appointment, and I would call before and say, hey, make sure that they're in shorts, make sure that you have a hallway where we can watch them walking down, because I already know what the provider is going to do and what they're going to need to do. So sometimes those initial phone calls is, or what we had to do to get them prepared and to fill that time. So it was challenging, but we all made it work. And I think that, like she said, those new injuries, those new fresh injuries, really need to be evaluated in person. But there were some benefits to telehealth for sure, for follow-ups and not having the patients having to come all the way in. Great.
Questions are coming through as we finish one, so I'll post the next one. So some of my patients are asking for referral to a chiropractor for bone pain and stress fracture. What are your thoughts? We'll start with Dr. Boyd.
Yeah, so typically for me with those complaints, I typically do not use chiropractic care for that. That's not the place I start. If we've ruled out any sort of bony, for stress fractures, for the bone itself, I don't find, that's not the treatment of choice. But if there are other parts that we think are related to it, or the family typically has gone to a chiropractor regularly, I'm okay with that. But it's not my first choice as far as treatment. I would do other stuff first.
Great. So a question that I had as I was sitting and reflecting on your presentation is the uniqueness of, or maybe it's not unique, and maybe I'm just not aware, the collaboration between yourself and your athletic trainer and Kelly. Can you speak to kind of the value of that collaboration and how that has really increased kind of your ability to care for your population? Dr. Boyd?
Yeah, no, it's great. So the way we're set up in our group is we have a whole group of athletic trainers. Usually one athletic trainer is paired with one doctor most of the time in our sports medicine clinics. And it's really, really great because we, they get to know the patients. Sometimes they're out in the field when they get hurt, covering events, and they come in. But in our office, we work together, and Kelly's very involved in figuring out what's going on with the patient. They understand sports. So when the kids come in and they're trying to explain how they got hurt or understanding why they need to get back, having that sports background is super helpful, and their knowledge of musculoskeletal medicine is helpful. And then afterwards, if there's something like, hey, can you show them how to stretch this? Can you go over these rehab exercises? They also have that knowledge base. So it makes for a really great comprehensive visit, and we work well together. So I usually have an athletic trainer with me in clinic with every patient I see. Kelly's who's usually there unless she's got pulled away for some other reason or needs a little break. So yeah, I'm very fortunate, and it's a really good use of our resources, and it helps us. I think it helps us a lot develop a good established relationship with our patients.
Fantastic. And then just to wrap up the conversation, I'm hoping that you can provide our attendees and our audience with at least one key takeaway from this conversation on return to play, this post-pandemic life. If you think about your experiences, the challenges that has been faced over the past 2 years, kind of moving forward, what's a key takeaway for this audience? Kelly, can you start, and then we'll go to Dr. Boyd.
Yeah, I think obviously posture, right? So I think one of my key takeaways is just the importance of accepting the fact that we are, even though the pandemic is over, we're still seeing our young athletes sit a lot and in these weird positions. And so I think that, all the pediatricians out there and other departments, like bringing awareness to it is one of the first steps. And I mean, even when I had an injury myself, and one of the things that my physical therapist told me is like, you're just kind of hunched over. And so that, just having someone else tell me that, I constantly bring my shoulders back. I'm constantly correcting myself, and I'm aware of it. And so I think just having that come from the initial start of the pediatrician might be helpful for those athletes. And then they come to our clinic, for continued pain, and we say it too. And so it's all about awareness.
Excellent. Thank you.
Mine's going to be a little bit more, I don't know if esoteric is the right word, but I think one of the things that I learned the most in the pandemic is sports is super, super important to kids. And it's a really important part of the social dynamic of development and challenging themselves physically, mentally, but it can't become their identity. And I think we've got to be really, I think we've seen issues at the college level with that. We see a little bit less of it at the high school level. But I think it was really enlightening to watch families when their sports were taken away, what was left. And I think we need to use that as a reminder that we want to encourage sports and enjoy sports, but not let it become the kids' identities, because there's so much more out there. And I think for me, coming out of the pandemic and having to spend a whole year without that, it makes you realize that there's more to raising these kids than just their sports. Again, this is coming from somebody who is absolutely passionate about sports. And I can tell you the scores of all the College World Series games that are coming up this weekend. And I watch sports constantly, but it's part of me, but it can't be who you are. So that's
what a great way
topic.
No, but what a great way to wrap up. I think, and just center our focus and everything that we do. So I just want to thank Dr. Boyd, and I want to thank Kelly for just sharing your insights with us on this topic and spending this morning with us. And want to thank our attendees for also spending Friday morning with us. It's been great to have all of your questions and your engagement. Just as a reminder, our final session takes place this afternoon on common reasons for acute pain consultations. We hope you can join us as we wrap things up for this year's Children's Week. So thank you, and have a great Friday and rest of your weekend.